Good afternoon, everyone. I'm Johanu Botha, the Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. We're seeing Manitoba hit new achievements when it comes to vaccination, and I want to begin by sharing some of these with you today. More than 1.2 million doses of vaccine have been given out to people to help protect them from COVID-19. We gave that 100,000 doses, the last one of our 1.2 million, over a period of 5 days, which is a new record in Manitoba, and a real testament to the people working to get this vaccine to everyone, and certainly to all Manitobans who are rolling up their sleeves. The pace is still strong and will continue to be so. Today, at the RBC Convention Centre, more than 9,500 doses are being administered, and they're planning for more than 9,000 every day over the next few days and into next week as well. And announced earlier this week, Manitoba hit its immunization targets earlier than expected, which means additional opportunities to get back to the things that we love sooner. We want it to be your turn to get immunized as quickly as possible. So, effective tomorrow at 11:45 a.m., we are opening up second dose eligibility to everyone. We are seeing strong interest in walk-in immunizations, and every super site except RBC is now offering that option. The number of doses that will be available for this walk-in option at any location will vary, but our goal is to provide this flexible option to as many people as we can. We'll continue to do our best to prioritize people who need their first dose when they come for walk-ins, but second dose people can still choose to try the walk-in option. One of the things that we talk about often are vaccine supplies and vaccine shipments. And as you've probably heard, we are expecting a lot of Moderna in the very near future, hundreds of thousands of doses. In response to this increase in expected supply, we're able to do a few things to expand reach and access to the vaccine. To prepare for even more supply coming in, we're, for example, testing extended clinic hours at RBC and Lila on June 28th. So appointments are now available from 8 a.m. to 10 p.m. And as we've said before, nothing is off the table, so certainly extending hours further with more supply coming in is under consideration, especially if it works well and the supply does arrive. And we are also sending more doses out to our medical clinics and pharmacy partners. Shipments are being sent out to them as soon as possible after the vaccine arrives in Manitoba. To give you a sense of how things are ramping up with these partners, between June 14th and 27th, we're shipping almost 60,000 mRNA vaccines to clinics and pharmacies, and the week after that, we expect to send almost another 20,000. Pharmacies and clinics that have doses available, either mRNA or AstraZeneca, are listed on our vaccine finder online, and they're also very likely promoting in their own community. So this is a great option if it works for you. In addition, we are allowing sites that would normally have been visited by one of our focused immunization teams to order and manage their own immunizations. So this would include personal care homes, long-term care facilities, hospitals, correctional facilities, and also helps regional health authorities to plan to immunize homebound individuals. A good example of this kind of model is an organization like St. Amant, which has received 700 doses for their clients in residence, and we're open to sharing more with them. Many of the people that St. Amant supports aren't well served by our super sites or other models, and they can face barriers navigating online and other systems. So this week, St. Amant set up a drive-through vaccine clinic to provide familiar faces and a relaxed environment for people with disabilities to receive their vaccines. The staff, volunteers, and immunizers are experienced in supporting people who may have fears, anxiety, who may need some extra time to go through the vaccination process. And so this is a perfect example of how we can support getting vaccine out as effectively as possible with a focus on inclusion and accessibility and using a person-centered approach. We're also really excited about the community-led clinics that are happening throughout our province this week and will continue to do so throughout the rest of the vaccine rollout. We've talked a bit about these in the last week or so, and there'll be more announcements about them next week and going forward. But as the name suggests, they're community-led. So these are nonprofit organizations, businesses, churches, post-secondary institutions who have the ability to organize and host an immunization clinic. And while these are smaller locations that may operate for a day or a few days with not thousands of doses, they can reach people who might not otherwise be able to visit our sites. More community-led clinics are being requested and put in place in our planning timeline all the time. So this isn't an exhaustive list, but I wanted to share some concrete examples of spaces where this kind of work is happening. Examples of community organizations and groups include West End Women's Centre, New Directions, Nigerian Association of Manitoba, the Punjab Cultural Centre, Winnipeg Grand Mosque, Immigrant and Refugee Community Organization of Manitoba, Westman Immigration, and Under One Roof. Some of the businesses that we've been working with to set up these community-hosted clinics include New Flyer, MacDon, High Life, McCain's, and Maple Leaf Foods. And educational institutions include the Red River College, the University of Winnipeg, and the University of Manitoba. I want to be clear that these community-led clinics are meant for the specific workplace, community, or ethnocultural group for which they were developed. In fact, we've seen how well this kind of approach can work with our pop-up and urban Indigenous clinics. They are not meant for groups that they were not developed for. This week alone, our pop-up and urban Indigenous clinics will be giving more than 15,000 doses of vaccine. For the urban Indigenous sites, they're offering additional supports in a familiar and culturally safe space with a mix of appointments and walk-ins to better meet the needs of these communities. And the pop-ups, of course, help us bridge the geographic spaces between our super sites, given how large and geographically complex our province can be. And we are also continuing efforts to reach people where they're at with our mobile clinics. Street Links and Main Street Project are helping to immunize their clients, which is successful because they're known and they're trusted by the communities they serve. And this means vulnerable people and other hard-to-reach populations can get their vaccine. To help support this work, a provincial mobile unit has also launched today. Again, it will be focusing on specific locations and communities that might face barriers in being immunized otherwise. So we really do want to ensure that this service is used by the right community. All of this to say, we know that every dose matters. The speedy remaining second doses that are flying through our super sites and the remaining first doses as well. We will continue to get needles into arms as quickly as we can, but it is important that we strike this balance with communities and the people we need to connect with. If you're a parent, you know that the news about large shipments of vaccine ring a bit hollow at this time. Our Pfizer supply in the short term is extremely limited. And right now, that's the only type of vaccine approved for young people aged 12 to 17. Dr. Reimer will speak to this a little bit more, but for parents and caregivers, we want you to know that if you have a Pfizer appointment, you can reach out to the call center. They've put a process in place so that you can transfer your Pfizer appointment to your child and then make a different appointment for yourself. It's an interim solution. The Pfizer supply chain will stabilize. We'll still get the same amount of Pfizer as we expected by the end of July, but we do have this in place at this time. Before I pass it to Dr. Reimer, a big thanks to True North Sports and Entertainment, who helped even more people get immunized. We know that you cannot get the second dose if you have not had the first. So their first dose community vaccination tour was a great opportunity to do just that. Last week, they visited sites in Winnipeg, Gimli, Morden, Brandon, and they held a virtual event in Thompson as well. Their visits were well received, and it all helped drive home the message for people to get out there and get your first dose if you don't have a dose yet. Lastly, on a slightly more personal note, I was fortunate to be able to cap off our celebration of 1 million thanks for 1 million doses last week by visiting the Gimli super site on Friday. It was superbly run. Everything was so highly organized. It was safe, it was efficient, it was pleasant, it was friendly. I can't say enough great things about the clinic manager, James, and the amazing team at Gimli. Thank you for all you're doing. We share so much information about what's happening at the super sites, particularly the large ones in Winnipeg, but every location is playing a critical role to bring us all closer to a fully vaccinated Manitoba every single day. We are grateful to every person working at every super site, pop-up site, urban Indigenous clinic, at clinics and pharmacies, and to all of our community partners. You are all protecting Manitobans and offering your incredible dedication to this historic effort. We truly are in this all together. And with that, over to you, Dr. Reimer.
Thanks, Johanu. Good afternoon, everyone. I'm Dr. Joss Reimer, Medical Lead for the Vaccine Implementation Task Force. I want to start by talking about first doses. And while Johanu has already spoken about the many spaces where you can get your first dose and how we're partnering with people to reduce barriers and make it simpler, I also want to speak to this briefly from a medical perspective. Your first dose is absolutely critical to protecting you, protecting your family, and protecting the people that you come in contact with. There are many people who face barriers in getting the vaccine, and so all of the outreach and community work is essential in order to meet the needs of these individuals. But if you aren't a person who's facing these barriers, and you still haven't gotten the vaccine, and you haven't gotten COVID infection either, you may be wondering what's the risk for you and what's the hurry. So the big risk is that we don't yet know when or how we will reach true herd immunity against COVID. But what we do know is that every pocket in the province where people are not immunized where COVID has a chance to spread creates a risk. So it's a risk to the individuals who are not immunized, it's a risk to their health, but it's also a risk to everybody else in the community because we know the vaccines don't work 100% of the time. So I do ask everybody who's thinking that they want to wait and see how things go to book your appointment now. Talk to people who have received the vaccine, talk to your healthcare provider, and you can get lots of great information about how things have gone so far in the 2 billion doses that we've given worldwide. So don't let the lack of something bad happening stop you from going ahead with the vaccine now. And if you're still not sure, ask a healthcare provider that you trust. The province has good information, and you can get that information directly from the websites or from your doctor or healthcare provider. There are community organizations hosting webinars to keep people informed. You can look for reliable information from many great sources. Si vous avez des doutes, adressez-vous à un professionnel de la santé en qui vous avez confiance. La province a des bonnes informations à vous transmettre par l'entremise de votre médecin ou de votre fournisseur de soins de santé. Certains organismes communautaires organisent des webinaires pour raisonner la population. Vous pourrez trouver des informations fiables auprès de nombreuses et excellentes sources. I have participated in one town hall that was held by Doctors Manitoba, and many of my colleagues from across the province are also participating in these town halls to answer your questions. In fact, there is another one being held tonight. They're also all recorded and available online. So this is one example of an excellent resource where you can hear from doctors in your own community. One of the topics that was raised at one of the town halls that focused on parents and youth was around the risk of myocarditis and pericarditis among young people who are being immunized. So first of all, I want to talk about what those terms mean. So myocarditis refers to inflammation or swelling in the heart muscle, and pericarditis means inflammation or swelling in the lining around the heart. And there have been some reports of increased cases in the US and in Israel among young people after their second dose of a COVID vaccine. So I know when you hear about swelling of the heart, it can sound very scary. So today I want to share a few facts about myocarditis, and specifically about myocarditis related to the vaccine, that I hope will help lower that fear and help you still feel confident in these vaccines. We're still learning a lot as we go through this rollout, but here's what we do know. First, myocarditis is not a new condition. It can happen for many reasons. The most common cause of myocarditis is actually viral infections. And we know that COVID infections themselves are a cause of myocarditis. And in fact, myocarditis is far more common after a COVID infection than an immunization. The second thing that we know now is that the number of cases where this has happened in the US after a COVID vaccine is so small that we don't know for sure if it's connected to the vaccine. Voici ce que nous savons. Premièrement, la myocardite n'est pas une nouvelle maladie et elle peut avoir de nombreuses causes. Le plus souvent, elle est causée par une infection virale. Donc, le COVID peut elle-même être une cause de myocardite. Deuxièmement, le nombre de cas où une myocardite a été constaté après l'injection d'un vaccin contre le COVID est si faible que nous ne savons pas avec certitude s'il existe un lien avec le vaccin. Third, and probably most importantly, is that even if there is a link, the surveillance from the US is showing that almost every case is mild, is treatable with medications like Advil, and resolves completely with no lasting symptoms. So we really are talking about a different situation than when I had to talk to you in the past about blood clots. The US shared some numbers yesterday on what they are seeing, and I wanted to put them in context and help explain what those numbers would look like if we saw the same situation in Manitoba. If we gave 2 doses of vaccine to every single man in Manitoba between the ages of 18 and 24, based on the US data, we would prevent 840 COVID infections, 37 hospitalizations, and 9 ICU admissions. In this same scenario, we would expect to see 3 cases of myocarditis, all of which would be expected to be mild and resolve completely. If we apply the same US data to youth, both male and female, aged 12 to 17 in Manitoba, and we gave all of them a vaccine, we would prevent 945 cases of COVID-19. We would stop 26 youth from ending up in the hospital, and we would prevent 7 of them from requiring ICU care. In this scenario, we would also see 5 cases of myocarditis. And again, all of them would be expected to be mild and resolve with anti-inflammatory medications like Advil. Doctors in the US and in Canada still recommend getting the COVID-19 vaccine even for youth because the risks of severe illness or even death from a COVID-19 infection are much higher and much more serious than the risks associated with myocarditis. It is better to get the protection from being vaccinated than to stay at risk of getting COVID-19. And this is particularly true in Canada, where we actually have not seen any increase in the number of myocarditis cases after vaccines. In fact, in Canada so far, we're seeing fewer cases of myocarditis in people who are vaccinated than we would normally see in the general population. But all of that said, we take this seriously, and we watch these things very carefully. This is, again, a great example of how good our surveillance systems are for vaccine safety, both in Canada and in the US. We don't have any information about if other medications, foods, or naturopathic remedies cause myocarditis at increased rates. But despite not knowing this about other treatments, the US was able to detect a few hundred cases of myocarditis, even though they've given over 100 million doses of vaccine. So whether you have been immunized recently or not, people of any age should seek medical care if they experience a sudden onset of chest pain, shortness of breath, or feel like you have an unusually fast beating or fluttering or pounding heart. So I just want to summarize what we have seen. We think there may be a link between myocarditis and the vaccines after your second dose, but the numbers are incredibly low, and rates of myocarditis are much higher after infection. If there is a link, we've seen that the cases are very mild. 95% of the ones reported in the US resolved with no lingering symptoms. And in Canada, so far, we're not seeing the same flag, but we are watching. So for other parents, you may have concerns about how to get your 12 to 17-year-old their second dose. We know that they can only have Pfizer right now, and those doses are in a temporary short supply. So as Johanu mentioned, there is a process for you to give your Pfizer vaccine appointment to your child, and you can get a Moderna dose for your second dose instead. For those parents and young people where that's not an option, while we do want everyone fully immunized as quickly as possible, I also want to reassure you that it's okay if you have a slightly longer time frame between first and second doses from a clinical perspective. We want people to get their second dose as soon as possible because we know that the virus is still here in Manitoba, and we want people fully protected as quickly as possible. But if your second dose happens later than 28 days, I don't want you to worry about how well it will work. Studies have shown us that longer delays between doses actually leads to a stronger immune response after the second dose. So while we do want people to be immunized as quickly as possible, we don't want you to worry about how well that second dose will work if you do have to wait a bit longer to get it. And as you may know, Moderna has applied to get Health Canada approval for its vaccine to be authorized for ages 12 to 17 years old. Health Canada has not finalized their assessment, but we are hearing that this could be happening very soon. Comme vous le savez peut-être, Moderna a demandé l'autorisation de son vaccin pour les 12 à 17 ans. Santé Canada n'a pas encore terminé son évaluation, mais il semblerait que ce serait pour très bientôt. That will be really important news because we expect the approach will be the same for young people as it is for adults. And by that I mean that either mRNA vaccine is safe and effective for your first or second dose, and that it will be safe and effective to have a different second dose from your first if it means getting that second dose faster. So before we go to questions, I wanted to update everyone on our AstraZeneca supply. We continue to recommend that everyone who is able to take an mRNA vaccine should get one for their first and second dose, even if their first dose was AstraZeneca. However, there are some Manitobans who are not able to receive an mRNA vaccine. I want to be clear that while we recommend mRNA, we also know that it is better to receive a second dose of AstraZeneca than to not receive a second dose at all. For this reason, we have identified and posted on our website 15 pharmacies and clinics that will function as AstraZeneca hubs across the province. All of these sites will receive their first shipment of AstraZeneca by tomorrow, and if they go through all of their doses that are sent to them in the shipment, we will send them more. So for anyone who is not able to receive mRNA for any reason, you can contact any of the 15 sites to receive a dose of AstraZeneca. It does not matter where you received your first dose. So thank you to everyone in Manitoba who's rolled up their sleeve and is part of the more than 1.2 million doses that we've administered so far. And thank you to everyone who's had questions or concerns. We want to be able to answer those questions for you. We want you to feel comfortable and confident in your decision to get immunized. This is an unprecedented time for all of us, and I know that Manitobans are looking to us for current, trustworthy information, and that's a responsibility that both of us, as well as the whole task force, take incredibly seriously. We look forward to keeping you updated as we get more information, and with that, we will go to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from CJOB, Clay.
Good afternoon to both of you. Either one of you would like to comment on that opening statement that all Manitobans will be able to book a second dose appointment tomorrow? That seems to me quite significant.
Thanks, Clay. It is quite significant. It's a massive milestone. We've been sort of racing towards having all Manitobans being eligible for a very long time now. We had mentioned that the second dose eligibility expansion would move much quicker than we were able to move through first dose eligibility expansions, largely because of more supply coming in. We were able to do that mainly because of supply and sort of our careful planning around the appointment process. But it's a really, really big deal. Starting tomorrow, every Manitoban will be eligible to book. Now, we know that the one caveat to that is that while everyone 12 plus will be eligible to book, not all youth will be able to find an appointment because only Pfizer is available at the time, and those appointments are not being increased. That's why we have the process in place whereby adults can transfer to youth. But that caveat aside, it's a really big deal. We're very proud of the team. We're very excited.
Second question, how has the demand for the walk-ins been? I'm thinking about the big lineup the other day at the Shoppers in Osborne Village. And are you able to accommodate the demand that will go forward now that people can book their second dose?
So it's still a bit early days. You know, it's been about not even quite a week of having walk-ins as an option at all our super sites, RBC aside. So we'll have to see what the demand is like at our super sites. Certainly the initial demand was there, as we saw at Lila, and that means that the reality of the walk-in model is that individuals may be turned away or may have to wait longer. We're trying to minimize this occurring, especially for those who show up for their first dose. But the walk-in model, that is, it's one downside, is that if you do show up, we run out of doses for that day, you may have to be turned around. But we're very excited to see people show up for them. It's really good signs early on. We'd like to continue to see that at all our super sites. In terms of the example you mentioned at one of our pharmacy partners, as I've mentioned and as Dr. Reimer's mentioned, we're sending a lot of doses out to these partners, but they don't have an unlimited supply, so it's not. It's not that unlikely that you will see those kind of lineups at some pharmacies across the province. What I'd like to be able to tell those individuals is that we do have the walk-in option, not just at pharmacies and docs, but at super sites. And we can currently accommodate, looks like we can accommodate a lot of that demand. So if there are individuals who feels like they're standing in line too long at one of these options, there are options across the province as well, especially with the amount of Moderna coming in.
And last but not least, any update on how some of our communities, particularly the Southern Health Region, are getting more of their residents vaccinated, encouraged to get vaccinated? I'm thinking of, the RM of Stanley, for example.
I'll talk about a few of the delivery models, and then maybe Dr. Reimer, I'll pass to you in terms of just uptake in that region. So I mentioned a list. I give some concrete examples in my speaking notes about the community-hosted clinics that we have across the province. Many of those are in Southern, and we'll continue to work with both distributed channel partners and workplaces and community associations in Southern to continue to do so. There's been strong work on that front. I believe there's a couple clinics happening today where doctors are partnering with workplaces to allow either employees or newcomers to get their first dose. So that work continues, and that's why we sort of keep seeing the dose one not stop. We're sort of chipping away at it. But Dr. Reimer, in terms of uptake overall.
Yeah, I think we're largely seeing what we expected to see. We're going to see a slow and steady increase in the areas of the province where people have more questions. So this is not something that we expect will turn on a dime. We know that it takes time to answer those questions for people and to boost their confidence in the vaccine. So we've seen, Doctors Manitoba holding a town hall specifically aimed at Winkler, Morden, and Stanley area. We know that the clinics and pharmacies in that area are having doses available. Johanu just mentioned some of the work in partnership with newcomers or workplaces. So we're certainly optimistic that we'll continue to see an ever-increasing amount of people in that area being immunized as we go forward, but this is going to require a lot of ongoing work and outreach and communication with people who have those questions.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. I guess first question for Johanu. How long, so you said in the preamble about the Pfizer allotment still potentially coming by the end of July. Is that the case? I mean, I think right now for the first 2 weeks, it's about 80,000 less than you expected. Will that be made up before the end of July?
By all indications from the federal government, yes. We will still receive the same amount into Canada by the end of July, and then we will get our allocation allotment open for us to pull from the federal government by the end of July as well. So while we don't have a confirmed shipment, which is really what we wait for before opening up appointments, because we do everything we can to avoid canceling appointments, we don't have those confirmed shipments yet. We are getting information from the federal government signaling that they do not anticipate this Pfizer disruption to last beyond the first 2 weeks of July, and that we will have the option to be flush with Pfizer again by mid-end of July. But I should note, and maybe Dr. Reimer, this is a bit more your swim lane, I don't think that should be an indication for individuals to wait until end of July. There is vaccine in the province now that can be used and should be used. I don't know if there's anything else to add to that.
No, I completely agree. So for those people who had Pfizer for their first dose, if you're not able to get a Pfizer appointment right now, then we would encourage you to take one of the many different options we have available for Moderna to get yourself protected as quickly as possible. Of course, making sure that you have at least a minimum of 28 days between your first dose and your second dose.
All right, thanks for that. One of the things that comes up when you try and book an appointment, at least online, is the question of if it's been 28 days. So what's going to happen tomorrow when, everybody's eligible, but there's obviously a 28-day minimum? Do people have to wait until, like if say they got their first dose at the end of May and it hasn't been 20 days yet, or June 1st, I suppose, do they have to wait until it's 28 days, that interval, before they can book? Or can they book a date in advance knowing that their 28-day period will hit at that point or be past it?
Yeah, our focus will be just to make sure that they get the dose after that interval. So they can book.
So you talked a little bit about where we have the Moderna being approved for children 12 to 17. I know that the Feds met with, or Moderna, there was a meeting yesterday about it. how close are we to this getting approved for 12 to 17?
Well, I mean, we really can't speak on behalf of Health Canada. That's their decision, and they're working on that. But one of the things they were waiting for was a meeting that happened yesterday with ACIP, which is basically the American equivalent of NACI. And so that meeting, I attended that one as well, was quite reassuring. So they went through a number of different scenarios and a lot of numbers and research. And came up with conclusions that in the U.S. they still feel that the benefits of the vaccine clearly outweigh any risks that they might be seeing with myocarditis. So again, I can't speak on behalf of Health Canada, but knowing that that was one of the things that they were waiting for certainly indicates that one of those hurdles has been met, and we expect that will contribute to their decision making in the near future.
From CBC Radio Canada, Charles.
Hi. You're implementing a pilot of extending hours at some super sites. So my question is, what are the factors that you're monitoring for this pilot, and could we see this implemented in all super sites in the future?
Yeah, very likely. Very, very likely. It's a supply factor. So we're putting our plans in place between the right staffing and the facility management processes, and in some cases our municipal partners that we might be operating at a longer period of time than we've had to up to now, given the supply we've gotten. But our goal is still to get through most of the vaccine that comes into this province and that goes through super sites in approximately a week. So assuming that Manitobans show up and they want to continue to get doses, we want to be able to run our super sites at a rate that will allow us to get what we send through super sites out within a week, and that by definition will mean expanding hours. So next week is really in anticipation of more and more supply coming in. We've got a day, and maybe we'll do more days depending on supply to pilot this, and then we should be ready. That would be the goal, so that our super site hour capacity can reflect the amount of supply that comes in. And we'll update Manitobans when we're able to do so at the other super sites. Next week, June 28th, will be RBC and Lila for starters.
Thank you. And talking about the Moderna vaccine, if Moderna doesn't get approved soon by Health Canada, is there going to be enough Pfizer vaccine for the back to school in September?
By all accounts, from mid-July onwards, yes.
Okay. Thank you so much.
From CBC Manitoba, Marina.
Good afternoon. I just wanted to clarify a question that my colleague had asked earlier. So if I am trying to book my second vaccine dose tomorrow, can I just book it to be 28 days from my first dose? Or do I have to wait to book 28 days after my first dose?
No, our goal of the call center will be that everyone's eligible to book, but you'll have to book for a date that's after the 28-day interval.
Excellent. Thank you. We are hearing of widespread issues with the immunization card. Some people are having delays getting it, but probably more concerning is some people are saying that there's no record of one of their doses, including people that received their first vaccine months ago. The Premier this morning said about 3% of people are having this issue. Can you tell us what is causing it and what is being done to rectify it? Yeah,
for sure. So there's a couple of things there. I think the first thing is we certainly we appreciate that there's a frustration when individuals are looking for their records and they can't have it in a timely way. That's not what we want either. So we are actively addressing it, and so we don't want to minimize that. We are looking at it. Secondly, though, I wouldn't call this a widespread phenomenon. We are administering thousands of doses every single day. We're entering thousands of data, often detailed individual data, into the system. and 97% plus of that data is without an issue. So it doesn't minimize the experience of the 3%. We have to deal with it. We will deal with it, but it is by no means a systematic, widespread problem. It's one that we will fix, however. What we're doing to address it and to deal with it is to essentially get absolutely staff up and pull together a team to look through the database to see where this cleanup needs to happen. And that's just sort of become a priority. We're leveraging resources from across government and within the task force to do this. We hope to get through this. It's less of a data backlog and more of a cleanup. We hope to do that very, very soon and have an estimated time for that to be completed to Manitobans very, very soon. The reason for it is largely in those cases where you have individuals who either had a dose out of province and had to come in, or it was a remote rural community where it was entered in a specific way. Sometimes cases where individuals didn't have a public health information number. So there's sort of anomalies like that we have to work through to brainstorm why they're not aligned in the system. By all accounts, everyone's data is in the system. It's a matter of cleaning it up. So we're working at it. We anticipate a solution shortly, and once we know more, we will update Manitobans.
From the Canadian Press, Kelly.
I just want to go back to my colleague Marina's question. These vaccination cards, is there any plan to have them recognized across borders?
So I think that is, and I'll pass it to Dr. Reimer too, because maybe there's a clinical aspect to it. But I mean, that's more of a government policy question. I think we've always sort of said we'll provide this technology to be ready so that Manitobans aren't disadvantaged. But how other governments or how our government treats these and the responsibilities or benefits or requirements associated with them is a larger policy question that transcends the task force, at least on the operations side. Dr. Reimer, I don't know if there's anything to add to Vax cards and their use.
Yeah, I mean, our main focus is to make sure that Manitobans have access to the information that they'll need. We do know that the federal government is working on how they're going to communicate that at the border and how they're going to recognize different provinces, different countries, different types of vaccines. So there are folks in Manitoba who are meeting with the federal government on this regularly to help inform so that they know how our system works as they plan the national system. And the federal government's meeting with other countries as well so that hopefully we can have similar processes throughout the world to recognize doses. But this is really a live conversation with many different players. And so what we're committed to here is making sure that we can provide Manitobans the proof of their vaccines so that whatever system ends up being put in place either by Canada or other countries, that Manitobans have the tools that they need.
And we've seen a leveling of vaccinations in other prairie provinces, especially obviously when it comes to first doses. So what are we seeing trends in uptake for first and second doses here? And are you seeing any kind of concerning leveling off of that enthusiasm?
If we look at the booking behavior and individuals coming to our sites or coming to our various delivery models, yes, we've seen a leveling off of the dose one for a while, with sort of a bit of an uptick now again. Might be early days to know if it's because of incentives or if it's because of all these accessibility-based delivery models that we're putting in place. So by all accounts, we're seeing enough of an uptick, if I can call it that, to be confident that we'll meet all of our reopening targets, to be sure. But how much of an uptick, I think, still remains to be seen, and hence why we're doing everything we can to get Manitobans, especially those who don't have their first dose yet, to roll up their sleeves. In terms of the second dose, we're not seeing any slowdown whatsoever. In fact, this may change, of course, over time, but the booking behavior at the moment, almost suggests a 100% correlation between having had your first dose and wanting to get your second one. There's a very, very clear, positive sign that individuals want to get fully vaccinated. So that's the trends we've been seeing. I think, as you noted, it's fairly comparable to our sister prairie provinces.
And, vaccination rates are significantly lower in southern health regions. And you spoke generally about community-based plans, but are there any specific plans or community clinics or alternative measures that are targeting that region specifically?
A number, and I mean, I think we've mentioned this before. Some of those associations, groups, medical clinics don't necessarily need or want us to be publicizing or advertising them widely. They're working directly with a workplace or a community. But as Dr. Reimer and I have noted, there are physicians, pharmacists. Some yesterday, I believe there is one today, actively administering doses to newcomers, first doses as we speak. We've done things like, and this might sound like a small gesture to some, but I think it's a big deal to be welcoming in your own community. We've done things like have low German signs and cards at the Morden super site. We've had our community members at super sites in Steinbach and Morden. Those continue on, and then there are a couple church-based and a community association-based clinics to be hosted in a space that is comfortable for those communities under works. That's probably as much information as I think we're happy to provide at this time, unless Dr. Reimer, there's anything else on uptake in Southern beyond what we've already covered.
No, I think the main thing is just that we want those community organizations to be able to control how the vaccine is advertised and provided in the communities. So, if they ask us to share information with the public, we're happy to do so. But we also really want to respect that the entire purpose of this is that it's community-led. And so we're here to support however they want to advertise and reach out to their community, which for most of them is to do it directly.
From CTV Winnipeg, Michelle.
Hello to you both. I was looking at the update from the vaccine task force, the spreadsheets from this morning. We are getting a couple more shipments of Pfizer. Are there any new appointments that would be open beyond the middle of July, or are those all spoken for? And why not use the Pfizer that we have to give to the 12 to 17-year-olds and have all adults get Moderna? Why have we decided against that?
Yeah, so to the first one, question first. Thanks, Michelle. There's nothing new in the supply delivery, the confirmed shipment deliveries that was publicized this morning. That 30,000 or so that's coming the first week of July, and the 50,000 or so that's coming the second week of July that we've known that they're coming. Those are the ones that's been reduced. There's nothing new. There's nothing new confirmed from the federal government on Pfizer. Those are ones that we've been anticipating, actually for almost over a month now. And because we've been anticipating them for over a month, our appointment-based system allowed us to get individuals to put their hands up and claim a dose. So part of our planning is that individuals can get an appointment and claim a dose, and their name is on that dose, and we protect that dose for that individual. We do not have strategic stockpile management where we hold some aside for a scenario like when the federal government suddenly dropped a confirmed shipment delivery schedule, because by all accounts, when it's confirmed, we rely on that piece. We don't rely on their projections, but we do rely on a confirmed shipment delivery schedule. And so we did book based on those. If we had held something back, if we had engaged in what can nicely be called strategic stockpile management, the other way of calling that is doses and freezers, and we don't do that. Our goal is clinically and operationally to get jabs and arms as fast as we can. So all those doses are spoken for, all of them are planned for, but we recognize that many adults, particularly parents, would want to be able to give their dose to youth, someone 12 to 17. Hence why we've put in the process whereby while we will not take away a Pfizer dose for someone to whom we've committed a Pfizer dose, we are providing the option whereby adults can give their Pfizer to youth. Now, if Pfizer supply had dried up, that maybe we'd have a different consideration. If Dr. Reimer and her team had told us that youth absolutely need their second dose right on that 28-day mark, then we'd have to think about this differently. But because by all accounts, there's no harm in that delay, and because the federal government is going to provide us with more Pfizer from mid-July onwards, the best solution at the moment is to provide the option for someone to give away Pfizer, not to take away Pfizer from someone who's already booked it. That's sort of our nuanced approach at the time.
Thank you. About the extended hours, what went into the decision to doing this now? What's the benefit of doing this now, and why didn't we extend the hours of those super sites earlier?
Supply. We're going to get up to 250,000 doses in a period of less than a week. That's never happened, and so we've never been able to do that. Now we can do it.
Thank you.
From the Winnipeg Free Press, Danielle.
Hi there. So for the first 2 weeks of July, we have a Pfizer shortfall of about 80,000 doses. So how is the task force going to decide which people with appointments will be given Pfizer and which will be given Moderna?
Thanks, Danielle. Yeah, and I should have been more clear about that before. So because of the amount of Moderna coming in, and so because of non-appointments, non-Pfizer-based appointment doses that have been allocated for different streams, like some pop-ups and fits, where there hadn't been appointments yet, we could move those Pfizer allocations and support them with the Moderna coming in such a way that we don't have to cancel any existing Pfizer appointments. So what we can commit to is that every single individual who has a Pfizer appointment at the moment will have their appointment honored with a Pfizer dose. What we can't do at the current time, is open up new Pfizer appointments. So I should have been clear about that.
Okay, thank you for that additional clarification. And so can you speak at all about how many Manitobans have so far chosen to take Moderna instead of waiting for Pfizer?
I don't have that stat on hand, but we are seeing it happen. Part of the reason, and I should have mentioned that in the previous answer, part of the reason we're able to honor all these existing Pfizer appointments with Pfizer doses is because a good number of individuals did cancel their appointments and opt for a walk-in option Moderna or get Moderna earlier. So we're seeing a good bunch of people, a certain number of people do that. I just don't have a good stat on me at the moment, so it's something we can look at providing if it's easy for us to capture, or if we can capture it for you.
Okay, thanks. And my final question, when it comes to the incomplete vaccination records, you say it's not due to data entry delays, but rather cleaning up the data. So I guess the question is, what has happened to mess up the record entry? Was it that it was entered incorrectly to begin with, or is there perhaps an issue with using the consent forms to collect that data initially? What's happening there?
In almost all, there might have been a very small amount where there's incorrect data entry on the front end, but I think in almost all those cases, you had an individual for whom their data entry wasn't, if I can put it this way, quote unquote normal. It wasn't their regular public health information number, and they had their first dose at a super site and their second dose at a super site or one of our pop-ups. We're almost seeing no cases of that where there's any issues with entry. In some cases, there's a delay on the first dose because it was administered at a pharmacy or a doc. Those are being cleared away. In many other cases, it's because, I would say probably in most, it's because the provider was outside of the province. That's why it's such a small figure. Again, I don't want to minimize the impact on these individuals. It's we need to address it, and we will address it. But it's often because the type of data to be entered is not the ones we're usually experiencing at a super site. So it's more of a data cleanup than a backlog. I realize that's a distinction without a difference for people waiting for their Vax card. But we'll work cleaning that up and get the information to Manitobans.
From Global News, Anya.
Good afternoon. There are plenty of people who are urging others to give up their shots for teens, their 5G shots for teens. Obviously, that's not a bad thing. We're hearing it from you guys that people should do that if they're able, but some people aren't comfortable with mixing and are maybe feeling bad or shamed if they choose to keep their Pfizer appointment. So can you clarify if we are in a position right now where kids will not get a Pfizer shot unless adults give theirs up? And is it safe to call this a shortage now instead of just a slowdown?
So we are definitely not in a position where youth will not be able to get their dose unless adults give it up. That we're not in that scenario. We are anticipating either Moderna to be approved for youth or as well, Pfizer to arrive in quantities by mid-July so that youth can still have their dose, within our projected timelines. In terms of the interchangeability piece and how comfortable individuals can be to switch, between Pfizer and Moderna for their second dose, that's over to you, Dr. Reimer.
Yeah, I think the most important thing is that people get 2 doses of the vaccine. So we are encouraging people to not worry about getting the same brand if that's going to delay their second dose. But, very close behind that as the second best option is to get that second dose even if you're delaying it. So regardless of how comfortable people feel, we really want them to get that second dose. So, my message is, if it's going to delay your second dose, I encourage you to get the other product to ensure that you're protected as soon as possible. But if you're not comfortable with that, then, I also strongly encourage you to go ahead and get that second dose of the same product when that's available. We're not concerned about the long-term issues for youth having access. This is just a Well, I would say it's very challenging to know what the impact of any one town hall or one clinic is because we're trying to do so many things at the same time. So we do know that that each intervention is helpful because each intervention reaches different people. So the folks who are able to sign on to a town hall and watch that online may not be the same people who are reached at a community center when we have a walk-in clinic there. So all of these things together, we are seeing a slight increase in the number of first doses that are going out, and that's wonderful. And we do anticipate that as these big shipments of Moderna come in, that we'll see more first doses going out because we're able to provide it in so many more accessible locations compared to the past. So we're never going to know exactly which clinic or which town hall or fact sheet or website or social media outreach was the trigger for any specific individuals. But that doesn't diminish the need for us to be doing all of these at the same time so that we reach all Manitobans and help all of them to feel confident in the vaccine and make it convenient for them to get it.
Our final reporter this afternoon from the Brandon Sun, Kimberly.
Good afternoon. My question is, if I'm not a parent and I have an appointment for a Pfizer vaccine coming up, is it possible for me to donate my dose to someone 12 to 17 and allow that to go into, say, a pool and rebook for Moderna?
Not a pool per se, because if you just cancel your appointment, that appointment can be scooped up by someone that we don't or you don't know is someone within that 12 to 17 base cohort. However, the youth for whom you provide your dose does not have to be a child.
All right, thanks for that. Do you have any numbers on the first doses from walk-ins, and if so, do you have a breakdown of the areas?
So we're still working through what that looks like province-wide. This is Thursday of the first week where we've done this, so we don't have the full picture yet. But based on Leela, which has been running this. We've been running this longer at Leela. Our current sense is, obviously these proportions might change over time, but our current sense is very promising. We had between 2/3 and 3/4, depending on the day, first doses administered at the walk-ins. That doesn't mean that that's the proportion of individuals who showed up. In many cases, a lot of second dose individuals showed up, but those first dose individuals who do show up, we try and prioritize. So we're able to get the sort of balance of between 2/3 to 3/4 a day, with the majority of first doses, which is I think a nice balance. I think we sort of we get the first dose individuals that the clinical team really would like us to get while we move fast on D2 velocity. So I think we hope to see that going forward at all the super sites, but it's a bit early to tell.
Okay, thanks for that. My last question, and I apologize if this has already been covered, but so if a child is under 12 and the parents are both vaccinated, and this weekend is coming up and they are allowed to dine together, how does the child under 12 work into the grand scheme of things? Are they basically covered by the parents' double vaccination? Like, I'm not 100% sure how that works out in the grand scheme of things.
My understanding of the public health orders, which I think the final wording is still being worked on, but the intent is that certainly household members would be able to dine together regardless of vaccine status. But we really will have to wait for the final wording of the public health orders. For the travel specifically, there is already wording that says that a child who is under 12, if they're traveling and everybody over 12 that they're traveling with is vaccinated, that they wouldn't have to quarantine upon arrival to Manitoba. So we'll have to take that question back to Dr. Roussin to get the exact wording and plans for how a similar process would apply to restaurants.
Thank you, everyone. This concludes our media briefing.